My name is Sophia Silao. I'm a program officer at the NYHealth Foundation. Welcome. Before we begin, I invite you all to drop your name and organization in the chat. We want to show some love and support so we all know who has joined us on today's webinar. This session will be recorded and closed captioning is provided. Today's webinar will focus on building affirming health systems for LGBTQ+ communities. And our conversation will provide information about the health status of LGBT New Yorkers, the invaluable role of community spaces that offer affirming and aligned care, and how all of this is linked to community health and human rights. As you know, June is Pride Month, and cities and towns across the country are celebrating the progress and the resiliency of the LGBTQ community. Amidst all this, we're also seeing a growing wave of punitive legislation and funding cuts targeting DEI initiatives, which is curtailing access to life-saving care and treatment for thousands of New Yorkers and denying them of health services that members of the community want and deserve. I've invited representatives from a NYHealth Foundation grantee, the Lesbian, Gay, Bisexual, and Transgender Community Center, or the Center for short, to speak more about this topic. Dr. Carla Smith is CEO of the center, and as its first CEO of color, she's uniquely positioned to speak about the complexity of today's topic. She has over 25 years of experience advocating for social equity and justice, and has held positions at the Anti-Violence Project, Housing Works, and Urban Resource Institute. Our second speaker is Leah Minnelli, the Deputy Director of Philanthropy at the center. She brings a breadth of fundraising and project management experience and played a critical role in securing the necessary funding to launch the center's new Article 31 outpatient mental health clinic. Welcome, Carla and Leah. Thank you so much for being here.
Thank you.
Thanks for having us.
So let's start. I'd love to start with you, Carla, if you don't mind. Can you please set the stage for our discussion by painting a picture of the state of health of LGBTQ+ individuals in New York?
Sure. And Sophia, once again, thanks for the opportunity to share space and be in space with everyone. Happy Pride, everybody. It's a busy Pride month, as everybody can imagine and is probably aware. For those that aren't necessarily as familiar with the center, let me just share a little bit about the center and what we do. We've been around since 1983. The organization really grew out of the HIV/AIDS epidemic in terms of creating a space for community to come together, to be together safely, to advocate, to receive services, a place of hope and joy during a very difficult time. And those services have continued over the last 40 years and grown. We are now one of the largest LGBTQ plus service organizations in the country, serving more than 300,000 visitors annually across all of our programming, including mental health that you'll hear more about in a little bit, recovery services, HIV prevention. We work with youth. We do case management services, crime victim services, as well as arts and culture programming and some large-scale advocacy and organizing work. We see about 2,400 clients a year in terms of direct services. About 68% of our clients are BIPOC. 39% are identifying as trans and gender nonconforming. What makes us unique really is that a person can enter our doors through any one of our programs and access comprehensive services. So you could come in for mental health services, or you could come in for arts and culture and decide you need case management and housing support. You may want workforce development services. You may need substance recovery services. Once you access a door, you're able to access all of our support services based on your needs or how those needs may be changing. We really pride ourselves on offering a holistic approach. When I think about, and when we've been talking a lot about sort of the current state of health of LGBTQ plus individuals in the state and around the country, we know that our work is taking place against this backdrop of sort of hate and rhetoric and a hostile sort of environment, specifically targeting trans and gender nonconforming individuals. We know that there have been over 575 bills, according to the ACLU, that have been introduced across 49 different states in the country, really targeting trans people and youth and access to affirming care. We also have, as you know, and probably people on this line know, we have and are experiencing executive orders that are threatening our funding. And funding for services like the center offers. We know that those services are critical, more critical than ever, understanding that we have an influx of people coming in for support impacted by the rhetoric, specifically that we are hearing in our everyday environment. 82% of the people, LGBT identified New Yorkers, cite mental health as one of their primary concerns, right? Really need help, and with over 1/3 being unable to access support. We know that those numbers are high for youth, and that youth in particular, according to the Trevor Project, close to 40% considered suicide. And so mental health services are critically needed for our community members. And to be able to provide those services in ways that are responsive to the ways that people are identifying, those intersecting ways that people identify. We've had an increase of about 31% since the pandemic of people seeking support. And so we know that their need for services is acute, with people who are navigating uncertain times, and parents in particular who are navigating fears for their children, right? And really wanting to have access and needing support on how to support their kids, and the multiple ways in which children are identifying, but also how to support them in a very hostile environment.
Thank you, Carla. I mean, that's such a powerful way to sort of set the stage for us. And a lot of the data that you provided also kind of underscores the importance of being able to collect that information, right? Because it also helps to shape public health initiatives and community programs. So I do think that that's important for us to underscore as well. I wanted to just invite you, Leah, to share a little bit more, and if we could drill down to understand a little bit more about the work of the center. And or before that, if you could just sort of share what are some of the common blind spots around traditional health settings or social service models that can hinder access to the essential care that's needed by individuals.
Definitely. And thank you so much for having Carla and I. The fact is that there are a number of structural blind spots in traditional healthcare models that do alienate LGBTQ plus individuals. Many systems are built on binary definitions of gender, with forms, records, and processes that exclude or mislabel trans and non-binary people. Often LGBTQ people are pathologized or treated as complex cases, when in reality, these systems can lack the training or humility to respond with care. Often there are providers who are not trained in trauma-informed practices specific to LGBTQ plus populations. And this can mean that the care feels clinical, rushed, or unsafe, even when well-intended. And there can be a lack of representation among staff and leadership in these healthcare and social services institutions that contribute to that mistrust, as does the absence of meaningful partnerships. All of this is further compounded by additional obstacles that LGBTQ people can face in terms of accessing the care they need. Affordability is a major barrier. According to the Williams Institute, LGBTQ populations experience poverty at higher rates than their straight and cis counterparts. It's 15% compared to 12% nationally. That number increases to 1 in 4 when you look at the BIPOC LGBTQ populations. This means that they struggle to afford care. They lack the insurance coverage for those affirming services. And often even with coverage, oftentimes public insurance through Medicaid, Medicare, it's limited in terms of institutions that will accept that as a form of reimbursable insurance. There's also the fear of stigma and judgment, especially among the trans and non-binary people, which often deters them from seeking care. The fact is they want affirmation, not invalidation. As I mentioned, there is also this shortage. It's something that we talk about at the center, that already when you were dealing in the mental health space in terms of counselors and clinicians, a lot of people will choose to go the private route because they know that there's more money. in that, as opposed to relying on a client base, a portfolio of people who are on public insurance. So that already shrinks the funnel in terms of people who are interested in this work. When you add the extra layer of having an LGBTQ competency, a cultural competency, that further shrinks the number of available and competent providers in this space. The last thing I will say about all of this, just sort of underlying this legacy, is a painful history around the LGBTQ community and the traditional healthcare space. There's been the pathologizing of homosexuality in psychiatry. There was the neglect of these people during the HIV/AIDS epidemic, and there is the ongoing denial of gender-affirming care for trans people. And all of this shapes how care is delivered and also how it's received. That is a huge reason why the center launched something rare in New York City, which is a licensed Article 31 mental health clinic for folks 13 plus, fully integrated within the LGBTQ community center. This is work that we started before the pandemic in 2019 through a community needs assessment, where people really expressed a desire to have this type of affirming care. Obviously, some of that work was paused as a result of the pandemic. We picked it back up in 2021 with McKinsey and did a landscape analysis and really saw that though there were providers in the nonprofit space providing this work, they were incredibly under-resourced and understaffed. So it made sense for us to sort of throw our hat in the ring. Prior to that, we were providing short-term visits, short-term counseling, which maxed out at 12 visits. Anybody who's experienced some type of mental health crisis or perhaps something that is more long-term, 12 visits is simply not enough. And we were having to refer them elsewhere, often to places with wait lists. This also wasn't a service that was available for youth. It was started at 18 plus. And as Carla mentioned, when we consider the statistics around LGBTQ youth adolescents, we knew that this was an area that we really needed to jump in on. And we also did want to make sure that we provided affirming care through the psychiatry lens. We have an incredible individual who leads all of our psychiatry work in a culturally competent way. And it's something that we're deeply proud of. It is something that is not just about treating the symptoms, it's about helping people build stable, full lives. And services that reflect the reality of LGBTQ plus lived experiences rather than forcing them to fit into systems that, quite frankly, were never designed for them.
Absolutely, and thank you for sharing more about this new Article 31 center. We're very, very excited to support the helping to birth that very important resource for the community. Carla, you had actually spoken briefly earlier about the unique model of the center, and clearly Leia's comments also helped to illustrate that. I wanted to see if we could add a little bit more of a personal touch to this and see if you have any stories that can help illustrate, why this type of care is so critical and urgently needed at the moment.
Yeah, I mean, there are tons of stories that I feel privileged to witness and hear every day at the center. And I just want to reiterate what Leah said. The Article 31 clinic, to me, is just one of the most wonderful service options that we are offering here, especially at this moment, and especially being able to open the door to long-term care for youth and their parents, to me, is vital. And in part because of the stories that we are hearing from community members on a regular basis. I guess I would share one story in particular that stayed with me and really touched me in personal ways. I'm a parent as well. And so I had met a mom a few months ago whose child had come out as trans and was met with a lot of discrimination and just outright cruelty that we often see, right? But don't always hear about. And the mom felt utterly powerless and desperate. She didn't really know where to start. or how to advocate and support her child, was doing the best that she could. And heartbreakingly, her child took their own life. She came to the center during one of our Trans Day of Remembrance celebrations to lift up the memory of her child and to be at the center. And I had a chance to talk to her and to really, besides sort of hug and cry, which I will do on occasion, to really share with her the information about the mental health clinic, right? And to talk about that. And she conveyed how much she wished she knew that that place was available and had existed at the time that her child needed support, just really reiterating why it's so important for us to have these services available. And, you know, it's clear that her child's death was not something that was inevitable, right? It was a result of a system that really ignored and failed, right? And so having, knowing that that is a larger crisis that's looming, right? That we continue to hear from kids, especially kids who identify as trans and non-binary, that these are challenges they're facing, and that the continued rhetoric that they hear each and every day while we live in a sanctuary city, to a large part, they are not immune from what we are hearing, and their wellness, their mental wellness is impacted by that. That conversation with her changed us and changed what we thought about in terms of how we wanted to focus our mental health services. And so we really decided to make sure that we had support for parents, and that we were focusing, that ability to focus on 13 and older was tremendous, right? But to really provide an opportunity for parents to have a resource with each other, but to also have a therapeutic resource, so that they could be the best support systems for their kids, and we could alleviate and support their mental wellness as they sort of struggled through some very challenging times. And so really looking at the whole family, as opposed to just the individual, and to do it in a place that is affirming, that is welcoming, and that has people who look like the people we're serving, right? And non-threatening is vital and critical now more than ever. And to have people come in and talk about how, parents come in with their kids and talk about how the center is saving their child's life, is just proof in the pudding of what this work means, the impact that it could have, and the lives that we will continue to save. So making sure that we're able to resource ourselves enough to be able to meet the demand, right? The demand is high, and we will continue to need to grow, but also to have a role in helping others develop similar type programming, right? We can't do this work alone. And so how do we help others become culturally competent, and to provide services, similar type of services, reflective of the community needs, and be able to adjust to those needs as those things change over time. And that's one of many, many, many stories, but probably the most impactful that has touched me and that has touched other staff as we think about it. We decided to focus one of our more recent hires as a clinician who provides support directly to adolescents and families, specifically as a result of this.
Thank you for sharing that, and I hope the parent can take comfort in the legacy of her child and helping to transform the work within the center and across the way. And then actually a question came in the chat that's apropos of what you just shared, Carla. Does the center offer or recommend specific trauma-informed behavioral health training, especially as it might be embodied there?
Yeah, our staff engages in training internally. I'm happy to be able to connect people to our senior director of our behavioral health program to really talk through some of that. We do some training internally and then can send people out to training. A lot of the training happens here on site. We have an orientation program that people go through. You know, we really do quite extensive vetting of potential candidates who are going to be stepping into space, to make sure that they have the skills that we need them to have to be able to provide that trauma-informed care. and then understand where those things need to be developed, and then can support them through ongoing supervision, one-on-one and group supervision, to make sure that they're getting the clinical support as we continue to move forward, and that they have support as they continue to sort of hear, you know, and sort of support clients through traumatic things that may be happening over time. But we're happy to sort of send out information and connect those to our leader in that area. I'm willing to share that with people too, so that we can get you access to support and resources.
That's great. Thank you so much. And again, as just a reminder to the audience, this is being recorded, and a briefing of the session will be sent out, and we can most definitely add those resources so folks can access it. And so I actually, given the fact that it is Pride Month, and it's a time for a celebration and also sort of celebrating resilience, I wanted to give you guys an opportunity to maybe share some information about how the center is continuing to center joy or promote resiliency. I don't know if Leah, if you wanted to jump in on some of that, or.
Sure. Yeah, I mean, the reality is, for anyone on this call, no matter what sector you're in, it's a bit of a tough time right now for nonprofits, regardless of, what sector you're in. And the center's not unique, but we do have challenges that are specific when you are serving trans people, youth, immigrants, new arrivals, things that often put us in the political crosshairs. But it is something that I'm proud to say that the center, under Carla's leadership, really does make an effort to find joy. Sophia, as we, spoke about previously, we had the launch of our official ribbon cutting last week, and it was nice to have a really beautiful silver lining in an otherwise sometimes very dark cloud. And it's really important, I think, now more than ever, to hold on to those opportunities to be in space with each other. As we've mentioned, we have launched the clinic that was launched this spring. So it is a way of, not just finding joy, but also making sure that we have appropriate care and resilience. We are also, just in terms of, we are lucky being a community center. We have over 300,000 visitors who come through our doors annually, in addition to what Carla mentioned in terms of the direct services. And we have 400 community groups that call the center home. So that means that people who are coming to the center, perhaps for direct services, can also avail themselves of all the other incredible community groups that we have happening. Some of those are around arts and culture. Some of those are around support. Some of those are around community networking. Some of those are around organizing and grassroots movements. And it is, I would argue, equally as important as any of the acute direct services. There's mental health with a capital MH, and there's mental health with a lowercase MH. And we really do try and build safety and strength through that model. It is Pride Month, as you pointed out. For those who are familiar with the parade route, it comes down 7th Avenue, which is a stone's throw away from our front doors. So we actually turn into a Pride pit stop where our entire building is open for the community on Pride Sunday. On Saturday, just this past Saturday, we had a Juneteenth block party. And we do try and have various events, particularly with the goal of marginalized populations, really centering those communities. Carla mentioned a Trans Day of Remembrance that we do in the fall. It's a really beautiful candlelit vigil followed by dinner for community members. We do 2 different types of pop-up shops. We have this beautiful auditorium. We turn it into a marketplace. We do one in February for Black History Month for Black LGBTQ plus creators and artisans. And we do one on March 31st for Trans Day of Visibility for the TGNC community. And it's really about making sure that we are constantly creating those spaces, whether it's through the community groups or through our own programming. Internally, as Carla mentioned, we are constantly investing in staff resilience and well-being, especially right now, recognizing that, our frontline workers are holding a lot. This includes increasing supervision, wellness efforts, and just space for collective processing. And then lastly, we are continuing to partner in coalition locally and on the state level, just to advocate for better protections and resources, knowing that the collective action is our strongest lever in the face of these challenges.
Yeah, I think there's definitely a lot going on, and also amazing to hear a lot of the other offerings that the center can provide to the community. And there was a comment or a statement that came in on the chat about, just to go back to Carla's earlier point about training and support, that clinicians can often feel that they've reached their limit when they're treating or working with trans individuals, the lack of education or even understanding or competence around working with the population. And I don't know if anyone wanted to respond to that or.
I'm happy to go ahead, Leah.
Well, I was going to say, we have a program specifically in our youth space called LIFT. And it really does speak to that in terms of that competency. And again, fully recognizing that, people are asked to do a lot with a little right now. And the program was really born out of that idea of how do we make sure that we are giving people the tools, the education, the vocabulary to be able to best respond to the needs of the LGBTQ community, specifically youth. The way the LIFT program works is that it basically is like a train the trainer model that happens here at the center, where folks who are directly interacting with young people, and this isn't just people who are in the clinical space, these are guidance counselors, these are people who are social workers in ACS, giving them those tools to basically help them act as that bridge between youth and their caregivers, all with the goal of, when we look at how really the alarming statistics around LGBTQ youth of, self-harm, substance use, suicide, homelessness, how do we make sure that we are creating an environment for young people where they don't deal with the rejection of their loved ones? And that program is really designed to help facilitate that, recognizing, as the individual put in the comments, reaching a wall in terms of their competency. So that's just one piece in terms of how the center thinks and responds to better serving the providers.
I would add, just to what Leah is saying, Sophia, just around, we have an intern program. So we have interns that come through the center, not only to support the growing work that we have, but really as an educational opportunity, so that people can really engage in supervised development of culturally competent skill sets, right? That are really mindful about the community and the intersecting ways we identify. We also really work hard to make sure that our staff are engaging in self-care, right? And are mindful around that, to make sure that as we engage in conversations in individual supervision, but group supervision and case conferencing, really helping to support one another through the work as we continue to hear changing stories and dynamics that are affecting the community we're serving. So those are some of the additional things. We would love to be able to have larger scale capacity building programs to help develop skill sets outside of the center. And maybe one day that will be some of our work beyond what Leah has described, but totally understand, Kelly, your concerns around people reaching capacity and wanting to be able to offer the best support possible to make sure that we're promoting wellness, not just for the people we're serving, but for the people we're providing the services.
Thank you. So I wanted to kind of bring us and shift gears a little bit. And I was hoping to hear from you, Carla, just in terms of, on a macro level, what are some of the emerging strategies, whether it's on a grassroots, statewide, or national level, to protect access to care or that show promise in shifting the way that healthcare delivery is offered to the community?
Yeah, I mean, a lot of this is connected to collaboration, but one of the things I'll start with is fighting back, right? And so the center has, of course, stepped out into litigation as part of a number of organizations across the country to fight back against the executive orders that are related to DEI, gender ideology, and some of the funding restrictions that were being posed. And that case was heard not that long ago, and results came in, and we have a preliminary injunction. And so that's one of the ways of sort of making sure we can continue to provide the support that we need while we still fight against these changes that are being proposed and have detrimental, impacts on our community. I think we're also seeing an increased level of engagement in grassroots and sort of statewide organizing and advocacy, and a desire and need to collaborate for organizations across the state and around the country, right? The center itself is not a 501c4. We're definitely a 501c3, so we have to operate within those constraints, but we have a strong advocacy arm that really engages both at the city and state level, and have had conversations outside of that as well, to make sure that we are fighting for the resources and support and access to that support for community members. I think we are shifting as we have started sort of navigated this new environment as a community and as organizations that come together to provide services for the community into more coordination, right? And community-driven sort of responses. And so really looking at what our organizations are individually doing and collectively doing, and figuring out how to move forward as resources begin to change over time, right? How do we pool service support? How do we pool advocacy efforts in a way that allow us to speak to the greater issues and have a larger impact? The center itself is participating in a number of sort of coalitions that have to deal with youth and mental health and sort of trauma work to make sure that we're advocating for policy change in that area. We have met with the governor's office as part of a statewide LGBTQIA+ summit, really continuing to push for coordinated responses and to homelessness and mental health inequities that we see. We've also met with the Attorney General's office, New York State Attorney General's office, Letitia James, and a group of attorney generals from across the nation to really talk about the impact of the funding cuts and how they're disproportionately impacting our community, and to really fight for those things and give them information that will help them do that work as well. And we've been advocating for additional resources. Really, there's a $5 million resource advocacy we've asked for Youth Mental Health Initiative. That's part of the council's 2024 Pride and Policy Plan. Our team is working very hard to make sure that we fight for transgender healthcare shield laws, any policy sort of area that we can step into that impacts our community. We are standing up alongside many, many others. We oversee the Health and Human Services LGBT network in the state, which is over 60 organizations. Some of them are probably on this call, and really feel privileged to work alongside dedicated partners fighting for support, resource access, and policies that impact our community. So those are some of the ways that we've stepped into and stepped out into the community a little bit more, given where we are. Lee, did I miss anything?
I think you covered it. I will say, I did notice that, Kelly, you commented in the chat just about ensuring that communities know what their rights are, which I think speaks to what Carla was saying in terms of the grassroots movement. There are organizations like the Center, which have various Know Your Rights efforts, whether it's around new arrivals and undocumented, whether it's around, trans populations. But I would also recommend things like NYHealth. They have a very robust list of resources around it, and they're actually the ones who are leading the update to the shield laws, of which Carla mentioned, and that we are part of the coalition. Unfortunately, the hard reality of it is that it is drinking from a water hose right now in terms of how everything is so drastically changing. And there are certain things that the center is able to lead on. But, you know, Sophia, we had a conversation about this last week, that when you take like Medicaid, Medicare, for example, something that is inherently built into our financial sustainability model of our direct services, and we're very much at the mercy of what happens to that on the national and state scale. This is not something that an $18 million a year organization can lead the charge on. So we're kind of recognizing that we are the small fish in this pond, and there are serious implications to it. And it is one that we are, you know, pulling what levers we have, but we also have to recognize what levers are actually for us to pull and what are the ones that we need to lean on, you know, other folks to do.
I do see there's a question that Kelly has posed around partners and information sessions. There is some work we're doing around know your rights trainings that are happening here specifically for immigrant communities that are happening in partnership with, we do them, the Hispanic Federation does them, NYC, New York Immigration Coalition. There are many sort of people leaning into that space. Specifically, we have previously held an information session around the litigation support with Lambda, and we'll probably be looking at opportunities to talk about that. I'm happy to also bring back to the team, Kelly and others online, opportunities around other topic areas that would be helpful for us to get the information out on, whether that be through information sessions or social media opportunities that we can explore. And I'm happy to connect with you offline to sort of talk that through as well.
Great. Thank you so much. And thank you for the questions. Keep them coming. So, you know, Carla and Leah, you had sort of talked about how there's a lot of change that's happening. Organizations have had to pivot in very different ways, and it's changing the way that that folks are just doing business, right? Like, I wanted to kind of hear from you guys, or maybe we could start with Carla and then Leah, feel free to jump in. Carla, with your CBO administrator hat on, how's some of this sort of playing out for the center and even nonprofits as a whole? Like, how is this affecting the way that you're doing your business on the day-to-day? Like, are you doing things differently? Or it's just sort of slight modifications?
Yeah, I mean, there's a lot of planning that is underway, right, with respect to the implications for potential existing and potential funding implications to the work, right? And so really taking time to map and scenario plan about what potentially could come down the pike, right? To be prepared for that, to have conversations with foundations like yourself, with donors around abilities to shift funding, to think of unrestricted funding. We're doing some of those things. I'm sure Leah will talk more about that. We're also partnering differently, right? Really spending time with other leaders to really talk through challenges that may be common or unique based on the particular services that we are offering, to really understand how can we work together better, and how can organizations who are doing the work that may not be in sort of naturally or spaces that are built to be inclusive, how can we work to help those organizations who are also touching our community become more inclusive and more affirming? Because we know we cannot be the one stop for everybody, right? Nor can any organization on this call with the resources that we have. So really trying to figure out, how do others who are doing this work, how do organizations that may not necessarily be have LGBT people as their primary client base, but who are also accessing those services, how can they become better positioned to be more affirming, be more welcoming, have the skill set that they need? How can they make sure that they're participating in events that we may be having at the center, right, in ways that they might not have in the past to make sure that people know that services are available inside center walls, outside center walls, through our partner organizations, and how can we sort of support that work moving forward, and if it's just sharing information and resources. And really looking at building we have a list of resources, right, in the city that exists. So really understanding and connecting with community members when they come back from engaging in those resources, to really understanding, how did it feel to be in that space? Was it affirming? Is there anything I can do as an advocate to sort of have a conversation with those providers around things they could do to either improve or make their spaces more accessible to our community so that people feel well served? Or if it was a great experience, being able to say, hey, thank you. This was a great experience for our clients, right? Really lifting people up when we're all being so squashed in lots of ways. And when we don't always get the compliments around the good things that are happening in our community. So really taking time to celebrate, right? We had talked about joy. We have to have joy every day at the center. We had an ice cream truck the other day. And so, which we brought in for
Why didn't you call me?
which we brought in for staff because it was Pride, and it was just time to sort of say, hey, let's take a moment, right? Or to have a flag raising ceremony, anything that sort of celebrates who we are as a community, the work that our team is doing. This is hard work, right? And so we know we can't do it alone. We need to be in partnership with one another. I've been talking about no space between the letters since I got here, right? That's something that we're really dedicated to, is making sure that we don't allow people who want to divide us and separate us from one another to do that, because we're so much stronger together in serving our community and meeting our community needs when we do that work together.
That's awesome. Leah?
Well, I will add, you had started the question in terms of, is this changing how we are approaching our work? And from a funding and operations side, the answer is yes. I mentioned us kind of heavily, closely watching the Medicaid, Medicare, because of what that could mean for us financially. And again, I'm sure the center is not unique. If there are other nonprofits on this call, they are probably experiencing it themselves. There's massive instability in the private and public funding, specifically in the corporate space. We are seeing corporate dollars retreat and retract. We are seeing allyship in terms of that public visibility retract. And all of this is happening while the public funding has a huge question mark around it. We know from a federal funding perspective that the chance of getting renewals for some of our grants does not feel like something that we should be banking on over the next couple of years. It is also figuring out what exactly this means for state funding that we get in terms of political pressures that can be exerted. And there's also things that we're considering around safety and data privacy. There's the physical safety of the building. We are an open community space, and having to be mindful of there being a target on our back right now. One that is important for us to protect community members and staff, and also make sure that people who are coming in here feel that, their safety is paramount. And there's also the digital side of this. We have some information, all HIPAA compliant, but that it is important to make sure that we have the highest standards of privacy and care around that, so that we don't mismanage the trust that people are putting in us. But there's also the aspect of data in terms of reporting that, is an ongoing conversation that we're having in the public and private funding space. We have funders who want us to track certain information, and the reality is that we have community members that are afraid to answer those questions. And as I said, we are always going to put the safety of our community members first. There is also the recognition that tracking that information can make us ineligible for certain grants under the current environment that we are existing in. And it is just the type of thing where, you know, it feels kind of crazy in 2025 that we're having this conversation about whether or not to ask a question about somebody's gender, just so that we can put on an application we do not track. Because we know using certain words in public grants will make us ineligible. But we also know not having that information can make us ineligible for other grants. And I think that, you know, what I would say is sort of my pitch to anybody on this call is that we're operating under a new sort of framework and a new environment. And I think that it does require us to look at and reevaluate how we approach our work. You know, Carly, you said it in terms of how we're approaching our partnerships and sort of the division of services, but it also, I think, requires all partners at all levels of the spectrum to really think about what potentially can be rate limiting steps for organizations in the service and delivery of their mission.
Yeah, I mean, you definitely touched on, Leah, that's a question that came up in my mind in terms of, you know, how funders or donors can think differently about how they're looking at programs like the center. And you shared some ideas, and I don't know if Carla, you also had anything else that you wanted to sort of pass on to those of us who are thinking about that.
You know, I think it's you know, what we've appreciated, and the team has been really great about this, and our, you know, places like the foundation have been great, is reaching out to your organizations, right? And having those conversations. We've so appreciated the partnership, right? And not just it's a funder and an organization, but a true partnership in thinking about and promoting the impact, your ability to impact the community that you are both sort of interested in. And so being able to have those open conversations around the challenges in ways that we haven't done that. We haven't sort of done that traditionally. I think this sort of environment has really allowed us to talk about things and strategize together, really about how do we make sure that our community can continue to have access to the support that it's needed. And it's a real partnership, as opposed to just this like funder and recipient or grantee partnership, but a real service partnership with the goal of, you know, enhancing access and enhancing impact and wellness, health and wellness.
I would also add to that, that I think it's really important for providers and hospitals to self-identify themselves to LGBTQ organizations, letting them know that they want to be in space with them, whether or not that is from an opportunity of learning, whether that's an opportunity of partnership, whether or not that's an opportunity of raising their hand and saying, like, you know, if you have folks in this area, I have, you know, a competency around providing care for, you know, fill in the blank population. You know, the center maintains a directory of affirming providers. We have partners who do this. One that, you know, Sophia, you actually met this individual last week. The Alana Faith Chen Foundation. They keep a national directory of LGBTQ affirming providers, recognizing that there are certain places in this country where they are very much a dime a dozen. I, you know, encourage all of you to check out their website if this is something that you feel that you have the bandwidth and the skill set to be able to provide. That's one area that I think that people can support the LGBTQ plus community. I think another way is, again, just making systems, making organizations, making hospitals known to LGBTQ organizations. You know, no, any organization that says that they can do it all from start to finish is lying, and they're not a good investment and not a good bet. It really does take partnership through the entire spectrum of this. And I think that the more people at the center or places like the center know what other organizations and opportunities exist in the world beyond their nonprofit walls, the better they're going to be able to serve the community members that come through their doors.
Thank you. So, you know, we're kind of coming up to time, and clearly there's a lot we touched on a lot of things, and certainly we can have a longer conversation about it. You know, a lot of folks are saying that the work is long-term and burnout backlash is real. Are there any particular sort of tips or advice to help you um, sustain your work and to support your team so that you can continue to stay grounded and, you know, continue the fight?
I can jump in, I guess. I would say, you know, you have to intentionally make space for joy. You have to be intentional about it. It is so hard not to have opportunities for that, but so important to do it, right? And to make sure that you are taking time to lift up and elevate successes, no matter how small or big they are, right? Really celebrate the work that your team is doing, because it's hard. It's hard work. It will continue to be hard, and it might get harder at times as we sort of navigate uncertainty. Really taking time to do that, I think, is part of self-care, right? And reinforcing the need to take time off, right? Social services, we're always working, and not necessarily taking time for each other. Really taking time to do that. We have meetings on a regular basis where it's just about, you know, we might have a puzzle day. We might have, you know, time where we're talking about lifting up each other, 30-second shares with one another. There's, you know, really wanting to experience joy in the midst of a very challenging environment, and celebrate. I don't think it's easy to do this work in any way, shape, or form, but it's so important. And it's so important to celebrate every single win and share impact with one another. We're doing so much different work, right? And so, but we have to have opportunities where the teams come together and sort of elevate each other and talk about successes and wins, and so that you can really feel the impact, because we're all so dedicated to making sure our community is supported.
I love that. And I really think that that's a great way to sort of wind down our conversation. It's always helpful to end on a hopeful and inspiring note, positive way for us to keep moving forward. So on that note, I want to thank you, Carla, Leah. Thank you for this, for your time and for sharing all of this information. And so we're so appreciative. Congratulations on your work. And I don't know if you're seeing some of the things on the chat. There's definitely a lot of praise that's coming in. So I also want to thank our communications officer, Erica Van Boxtel, for her help behind the scenes. There's a lot that always goes on and kind of help us to keep moving forward. So thank you for that, Erica. And thank you everyone for joining us. I hope that you found this informative and can feel inspired. And happy Pride. I hope you have a great day.
Happy Pride, everybody. If you don't have a place to march and you want to march, go to our website and sign up. We still got some spots left. We'd love to have you join our parade and celebrate with us. So come on into the city and join the center for the parade.
Thank
Happy
you.
Pride, everyone.
Pride.